Alright, what's going on, guys? Welcome to the video. So today I am in Kingsmill Dental Hygiene and I'm doing an interview with Joe Sigfried, who's a myofunctional therapist. And I'm really hoping this video can just give you guys some tips and information for how you can continue to improve. I think it's an interesting conversation that you can listen in on. Without further ado, let's get into the interview. Today we have Joe Sigfried, who is a dental hygienist, myofunctional therapist, and owner of Kingsmill Dental Hygiene. And I really wanted to have him on the video today because we're going to be talking about a lot of stuff related to the channel. So Joe, welcome. Thanks for coming.
Thanks.
And first thing, what is myofunctional therapy for those people who don't know? What do you do?
So myofunctional therapy is the practice of achieving ideal oral rest posture, which is tongue on the roof of your mouth in a nice relaxed position at all times. Improved nasal breathing. Those are the goals of myofunctional therapy: are ideal oral rest, improved nasal breathing, improved swallow patterns, so eliminating functional habits like tongue thrusts, thumb sucking, pacifier use, and then also achieving ideal lip competency. So lips closed at all times at rest without strain.
So I think people are going to get a lot of value out of this just from us talking about some things about how the jaw, how the tongue work together, and hopefully people can get some tips to improve from this video. But I wanted to talk about your story because I find it very interesting, like how you kind of started learning about this stuff. But it started when you had bicuspid extraction. So you actually had the premolars extracted. And so can you tell us a bit about how that happened?
So I didn't know any of this when I was a kid, obviously, but when I was a kid, I was that kid who I was always sick. I was the kid who was sick from school for a week because he couldn't breathe. And it wasn't something that, it was just normal for us. But I also had teeth taken out, extracted. My bicuspids were extracted as a kid. I actually only had 3 taken out as well. So they have this weird imbalance in there. But they were taken out to help make room, because I didn't have enough room for the teeth that were coming, my adult teeth coming in. Understandably, I didn't know any of this as a 7 or 8-year-old. One of the reasons that I wasn't making any room, and I know all this now because I'm an adult and I've learned it all through airway dentistry, is I was a kid who grew up in a smoker's home in the country, allergic to everything, and I couldn't breathe through my nose. So I was a mouth breather. My tonsils were huge, and they were taken out at the age of 7, 8, around the same time I had bicuspid extractions. And so all of that happened. And then suddenly everything sort of changed for me, but my jaws had already formed. Most of our bones in our head actually form and are pretty much at about 80% formed by about the age of 10, 11, 12. So everything had already happened for me. Now, from my perspective, I didn't start learning about this stuff till I became a dental hygienist. And I started working with a dentist who was airway focused and sleep focused. So I realized, and I was actually in the process of braces at the time, and I realized that there was a correlation between things like headaches and the fact that my teeth didn't come together properly, and I had this tiny little mouth, and that's where it sort of all started for me. But I learned, for me, the changes were later on when I revisited orthodontics as well. But it was really more about learning the process, and then 4 years after learning about this stuff, I started learning about myofunctional therapy and what the tongue is actually supposed to do and help grow our jaws.
So you had the extractions, and what was the experience like growing up, like through your adolescent years, your teen years, stuff like that? Were you still having health issues? Like, do you think that the extractions and the small palate and stuff, how did that affect you? What was the experience like? Did you notice that your face changed, or were you aware of any of this stuff growing up?
No, I wasn't really. I wouldn't have been aware of it, but I was always aware. I was the kid who never smiled in photographs, never showed my teeth. because I had pretty significant crowding on the upper jaw. So thinking back to it and looking at school photographs, I never had my mouth open for them, ever. So those are the things I think about. Health-wise, I was never an athletic kid. I could never manage athletics. I was a kid who was tagged with child onset asthma, which, I grew out of, which is a valid diagnosis, but there is evidence to show that acid reflux can be confused with childhood onset asthma. So was I a kid who, when I was doing exercise, was getting acid reflux, and that's why I couldn't breathe? Possibly, because everything was so narrow and so small. Those are the things I think about now. So did I suffer? Is that why I went through all those things like childhood onset asthma and not being very athletic as a kid? Possibly, because I couldn't breathe as well as I probably should be able to, or as efficiently. I guess I like to say that breathing more efficiently is what we try to achieve with Myo.
Yeah, and what about like the jaw? What about the growth of your jaw and stuff? I guess you just kind of thought this is how it looked.
Well, it was just normal, and it's a normal thing that we all go through the process and get braces. That's just, we've normalized the need for orthodontics and braces, right, and not necessarily getting to the root of the problem. Not that braces aren't valid and that we don't need them and orthodontics is not needed, but if you can prevent it by fixing the problem early, or at least prevent the structural, actually help the structure, because you can have crooked teeth but still have a nice big wide jaw. I mean, ideally if everything's in perfect growth pattern, you don't need them.
Right. So then so you obviously got older, you got into practicing with dentists and stuff like this. And at what point did you realize that I probably shouldn't have had those teeth extracted and this actually made my mouth smaller? Like at what point did you have that moment where you realized,
It was probably my learning process, so probably about 10 or 12 years ago when I started working with an airway-focused dentist. Even then, I didn't realize that it was the fact that I had bicuspid extractions was the reason it was detrimental. I think I learned it maybe when I started learning myofunctional therapy and learning about functional dentistry, I guess is what they call it. It would be a term. And what bicuspid extraction, the correlation of bicuspid extraction to people that have problems, I guess is what I want to say.
Sure. People
that have pain. Again, there's not a lot of science that supports it necessarily. I mean, there's no science that says bicuspid extraction causes sleep apnea, but there's no science that says it doesn't. And the correlation of the patients that I've been connected with over the last 10 years and their bicuspid extraction process, you see you observe observationally, you see the changes that it does to people.
Yeah, and so many of the dentists that I've spoken to who I trust, including, Dr. Mike Mew and several other people who I've listened to, basically say that you shouldn't extract teeth, in their opinions. And, I agree with this, and I think a lot of people online are realizing this and agreeing with this as well, and kind of seeing that the traditional practice of you don't have enough room for your teeth, so we're going to pull teeth out to make room and then straighten the teeth, but your jaw gets smaller. People are generally kind of afraid of that, right? So I think it leads to this notion that braces are bad. And that's not necessarily true, right? Because you have an Invisalign in right now. Mm-hmm. I actually have an Invisalign in right now as well. But when are braces kind of detrimental to someone's health? Like if someone's considering getting braces right now or has them, when would you say that braces, make your jaw smaller? And what's something that someone should ask their dentist or look out for when it comes to that?
I would say that if you're looking for a dentist or orthodontist that's wants to straighten your teeth using braces or Invisalign, I would say you want to ask about whether or not they're retractive in nature. Retractive meaning pulling things back. Because generally, anything that's retractive in nature isn't ideal for the oral cavity or the tongue or your oral rest posture positions. So that would be one of the questions that I would look at asking anybody that you're going down this path with. What kind of retraction is involved? Are you going to be retracting my man? Are you going to pull my jaws back to do it? And if I wouldn't, that's not the ideal thing for every case. That's not to say that it's not necessary in some cases. If you've got somebody who's had a very significant thrust pattern all their life and their maxilla is really far out compared to where the lower jaw position is. So it just depends on, obviously it's dependent on each case, but I would be wary of anybody who wants to extract teeth, and I would be less inclined to continue on with the dentist who was to be retractive in nature in any way, shape, or form.
So it's kind of you got expansion laterally as well as front to back.
Yeah.
And then that allowed your mandible to move forward, which from there you had more space for your tongue, you were breathing better.
Yeah.
And so how was that entire process for you? Like, because you still need to get implants, right?
You get to a point where trying to achieve perfection is a chase that you're never going to end. So, especially as an adult. So for me, I made the choice to stop brackets and start Invisalign because I found someone who doesn't allow aligners to be retractive in nature. So all that forward development that I got isn't going to go away. And it was a more, working in dentistry, it's like being the shoemaker's kid. You don't get in the chair as often as you want to. So the process by using aligners really helps me see the end of the orthodontic side of it, and then I'll start the implant process, which will take a couple of years because I've moved teeth through bone, and that makes the bone different. So the bone has to have time to remodel, and as it remodels, I may need to have bone put in to allow implants. Like, there's a lot of factors that roll into it if you're looking at opening up premolar spaces. Better to do it when you're really young, I would say, than not. But
and better to not have to do it at all.
Better to not, exactly. Yeah.
So what is the thing you were saying before about your opinion on extracting teeth in general? What is your opinion?
So my general opinion is I would say if somebody's going to suggest that you extract your premolars, we'll talk about wisdom teeth a little later. But if somebody's recommending that you have to extract your premolars for orthodontic reasons, I would ask them to really justify why. Is there another route? It's not impossible that it's necessary in a treatment plan. It's just, is there another way? A big mantra for me is in my process, and what I teach my students is we're supposed to keep all of our body parts, right? So if you think of that in a bigger picture concept, there should be another solution in order to keep all of our body parts.
Yeah, so you don't think generally extracting teeth is a good idea?
I personally don't think so, no.
And so what about wisdom teeth? Because this is interesting. I get this question a lot, and I don't entirely know how to answer it. So
wisdom teeth we are supposed to have 30, as humans, we are supposed to have 32 teeth in our mouths. As North Americans and as in generally first world nations, all humans now, I guess at this point, we aren't developing the jaws we used to. And there's a lot of theory and information as to why that is. So why aren't we developing our jaws? We're not developing our jaws because we don't chew food. We're not developing our jaws because we're mouth breathers and they're not allowed to develop properly. So there's not enough room for our wisdom teeth. And that's just the way that we have changed our genetic process, I would say. That's the way we've evolved. So our jaws are not growing long and full. And so when a dentist says your wisdom teeth need to come out, there's a reason for it. And the reason is because there's not enough room for them. And they're causing issues in the bone and issues with the tooth, possibly the tooth in front of it. And but I would, like any healthcare, you shouldn't just arbitrarily say, okay, I'll do it, without having all the information in front of you. If a dentist says, we need to take your wisdom teeth, ask them why. Find out why and have them explain why. Because if they can show you that a tooth is impacted and causing an infection, then yes, that should come out. So if you're young enough that some expansion can happen and you could possibly have room for them, sure. But as I said, all that growth happens before 10, 12, probably age 12, right? So realistically, at age 30, if somebody says take out your wisdom teeth, there's probably a good reason for it. And it's because your jaw's not big enough.
Yeah. So this leads into the next topic that I think is interesting, which is the fact that can your face change? So can people see changes even past the age of, like you said, 30, 40, even 50? Can people's faces continue to change? And one of the ways I think about this, because James Nestor did this experiment in his book Breathe, right, where he clogged his nose for 2 weeks. And it's a nightmare scene, basically, for all of his health indicators. But then his face also starts to look just like sunken in. Yeah. And that could be because of sleep deprivation as well. But I'm pretty confident if I didn't breathe through my nose for a year, my face would change. And that's what makes me think that the face can also change in a positive way. And so my question is, do you believe that? Do you believe that your face can change at any age?
Absolutely.
For better, for worse?
Oh, absolutely. We see changes with myofunctional therapy in faces, tissue tone, tissue color. You start breathing through your nose, you start getting a better night's sleep. That grayness goes away. Those people that are walking around and their faces are gray, those are the people that are not breathing properly. They're not getting enough oxygen to their tissues. So absolutely faces can change. Can you change facial structure? When the muscles are working in a more balanced, even pattern, absolutely the structure, the bones can change with the help of body workers and then maintaining that with an ideal oral rest posture. Absolutely. Are you going to get 6-7 millimeters of growth, but just to allow your wisdom teeth to come in just by using your tongue? There's no paper out there that has proved that can happen.
Right.
But you can change the tissue and tone of the muscles. You can change the tone of the tissue. You can change the shape of the tissue. You can change the shape of the arch, the bone, and it's proven that you can get up to 3-4 millimeters of growth between canines in the anterior part of your maxilla just by doing myofunctional therapy.
It's incredible.
So it's absolutely, there could be facial changes. You'll see lip line changes, fuller lips, because stronger lips, cheekbone changes.
I've seen these things.
Oh yeah, it's absolutely.
I've seen these things in myself. Yeah, and so you were talking about body work, right? And when you say body work, you mean like what I would say posture.
Yeah, so posturologists, osteopaths, chiropractors, all those kind of body workers. Thinking of it the opposite way, if you take out all of your teeth, and we've all seen it, not so much now, but 25 years ago when people are keeping their teeth longer, but you take out all your teeth, what happens? The bone starts to go away because you're not using it, and things start to shrink. The plugging your nose for a week, everything starts to elongate. And you're breathing through your mouth, so you're no longer an efficient breather. So oxygen to tissues isn't as efficient. And it can happen at any time. You can go through the process of getting the best of the best of the best that you can, and then trip down the stairs and it changes your posture for 6 weeks and you learn a different pattern, right? So there's always going to be an environmental thing that might change a body pattern that could happen, right?
Yeah, and actually, I have an interesting question because this is something I really wonder, which is that we know that our faces have been changing for the worst over longer periods of time, hundreds and thousands of years. If you look at ancient skulls, they have all their teeth. They generally have wide jaws, wide maxillas, to the point where, like Mike Mew says, we wouldn't even really recognize them. Like they would look strange to us if we saw them. That's kind of what he said. And I guess my question is, what's happening? Because even in a shorter time span, I notice now, I see so many kids where I look at them and I just say, it's just so obvious that they are breathing through their mouth, that their head is hanging forward, their face is already developing into a really negative pattern. What do you think is causing that in our society? What is the reason that our faces are developing in this way?
Well, there's no one answer to that, but I think that a combination of our world of technology, there's the concept of text neck. We don't chew food. That's been documented. West had probably started documenting it in the 30s. We feed our kids mush. They don't chew food. They don't chew. There's of course the variety of dietary things that we're not giving our kids. We rely heavily on technology to take care of our kids because we lead busy lives, because everybody has to work 20-hour days. We just changed the focus of how we live, and it's changed the way we breathe. It changes the way there's still tribes in Mexico and Africa that have that look and have all of their teeth. We see it in dentistry. We see it all the time. People that come to Canada from other countries that have lived in clear breathing countries, they have beautiful full arches, and it is definitely a sort of First Nations of the world thing. Braces don't exist in a lot of in tribes in Africa. It's not necessary.
Yeah. So yeah, like you touched on technology, you touched on breathing, and for me those seem to be the two big ones. I mean, to me it makes sense that these kids who are now on iPads and phones and computers for a lot of the time, they develop this forward head posture and then their tongue can't work properly because we know that there's a relationship there. Yeah. So now because of that, they start mouth breathing. For me, for example, I think I had an allergy when I was a kid at some period, or I was sick. So I have a memory of going to bed one night, I must have been 6 or 7 or something, and thinking to myself, oh, I'll just breathe through my mouth tonight, it's fine. And then it becomes a habit, and now you're just mouth breathing because you're used to that.
Well, I think we're ignoring the fact that we've normalized mouth breathing a little bit in the world. Like, I see it with some of the kids that I get. Kids are sent to me by a variety of different ways, and parents have parents who are mid to late 30s are also mouth breathers, and they have no idea that they're a mouth breather, and they don't know that was an issue. I think back to when my grandmother's mother, we were told to keep our mouths closed and chew our food and sit up straight. Does that still happen? We don't encourage as much with our kids to do those things because the generations we're past that generational process. The generation that's having kids now are the kids that stop being told to sit up straight. So we've sort of changed the pattern of what we think normal is. Right.
And yeah, so to me it seems like technology is a recent one, but these problems have been happening before we were on our phones all the time, long before. So really, it seems like one of the main things is breathing. And I know that, for example, when we moved as humans into indoor structures and things such as molds, things such as household pets, allergies. So you think that's a big cause of what causes a lot of people to mouth breathe?
So the main cause, and I come back to this with my students, is if you cannot breathe through your nose, you're never going to achieve an ideal oral rest posture. And I think anybody going down the path of airway centric orthodontics or myofunctional therapy or anything like that, they will eventually come to the conclusion that if you can't breathe through your nose, none of it's achievable. So why can't you breathe through your nose? So getting to the root, again, it comes back to the root cause, getting to the root cause of why you can't breathe through your nose. For me, it was, I grew up in a smoker's house and I was allergic to everything. But it was the 70s and you didn't get allergy tested. That wasn't a thing. So I grew up and I learned how to breathe through my mouth, right? So, and it's a similar process now. We're allergic, kids are allergic. There's so many allergens in our urban settings, like pollution. I mean, it's not just specific to foods or what have you. It's pollution. It's the variety of things that we're exposed to that don't allow us to breathe through our noses. Add that with sitting over a screen all day. Add that with not chewing food enough. This is another factor that we don't talk about and we don't think about, but we don't chew enough food. Food is fast and quick, and we got to get through dinner because we got to go here and we got to go there and we got to do this. We don't sit and eat our food long enough. When I do my assessments, I have people eat a bag of crunchy things, and I can't tell you how quickly most of them do it, and they don't chew it enough. So when you don't chew your food enough, you end up swallowing a chunk of food that's too big, so then you have to compensate by doing this and moving your neck because it's not chewed enough. And that's a part of it as well. Like giving our kids mush, but also not taking the time to eat.
Right, and not eating tough enough foods, like eating a lot of soft carbs and stuff like that. Yeah, so this is really good, and I want to touch on what parents can do for their kids at the end. But really quickly, I want to go back to what you were saying, like with your patients, and you said there's been studies done and it's been shown that through myofunctional therapy, you can get 3 to 4 millimeters of growth. So is that in kids? Is that in adults?
So both kids and adults. So kids, when you do myofunctional therapy with kids, you're working with growth. So they're growing at the time. And myofunctional therapy with kids can last anywhere from 8 months to a year. So you see significant changes over, and if you're working with a child who's in the process of orthodontics, the growth and movement all happens together. So you see it week to week to week, significant changes. Adults, it takes more time, and but that 3 to 4 millimeters between canines, and I'm talking about sort of the side to side, the lateral growth. So, and that growth happens over time with adults. And it depends on how spongy things are, I guess is the word too. Again, everybody's different. Not everybody's going to get 3 to 4 millimeters of growth.
People's bones are different.
Everybody's bones are different.
So
I see faster growth, faster changes in bites in somebody who's 18 years old versus somebody who's 60 years old.
Of course. And that was kind of my next question. This is a question people ask me. They say, I'm 25, I'm 30, can I still see changes?
Absolutely.
And in my mind, I say, of course. But how do you think about the age? So if you're below what age can you see really fast results in general, would you say?
I would probably say, below age 10 for sure, because you're growing, but you're still growing from 10 to, you still have a percentage of growth from sort of 10, 12 to 18. So you'll see all of that faster pattern before age 20, I would say. I guess if you want to call it a faster pattern. Once we all stop growing, which is around 17, 18, men and women are different, obviously, but the pattern is slower, but it's not impossible. I've had 25-year-olds with anterior open bites that close it within a year. Just getting the force out of there. So it's structurally changing something. The force of the tongue, if there's a thrust pattern. So you can see changes happen within a year, even as a 40-year-old. You'll see changes happen within a year as an adult, more significantly with soft tissue. So tissue in the back of your throat, your palate tissue, the soft tissue that hangs your in the oral pharynx tone.
You're talking about your soft palate, which is at the back of your palate, which affects your airway, right?
Yes.
And that can kind of change a lot more quickly.
Yes. Yeah, because
it's muscle.
Because it's muscle, exactly. It's muscle and tissue. So you can absolutely change that a lot faster. That's usually with my adult patients, that's the change that I see more. It's faster. Because I get the same question with my adults, can I change, will my teeth change and will my teeth shift? And I say absolutely, and visiting an orthodontist will help it change faster as an adult. That's just the truth to it. Getting some sort of expansion in there if you can, or some sort of, even, you want to visit somebody who's airway focused and has an understanding that retraction is not ideal. But even as an adult, getting expansion in the premolar area, it's common with somebody who's had orthodontics that their relapse happens a lot in the premolar area on the maxilla. So you get this sort of S-shaped arch. And so putting those premolars back and getting the tongue up to support it, that's commonly the change that somebody needs. But that structural change can happen with the tongue, but it just takes a long time. So I'll send people to ortho to help speed the process up because they want to feel better faster.
Yeah, so I guess one interesting thing for people that a lot of people ask me about, do you have any recommendations for dentists, et cetera, et cetera. And so I think an interesting thing to ask you is, how do you find a good dentist? How do you find an airway dentist? How do you find a holistic dentist? And you've talked about the idea of interview your dentist. Yeah. So can you talk a little bit about that?
So I think that we've become to think every dentist is the same, and I think probably most of your subscribers and people that know you know that not every dentist is the same at this point, because they're looking for answers. But essentially, there's no reason you can't interview a dentist and find out what kind of focus that they have. Do they have a whole body focus? What does that mean? Does that mean they have an understanding of airway development? Do they have an understanding of what it means to have a normal growth pattern? And everybody learns it, but we kind of accept that we are who we are. I would say that if your dentist is involved in sleep in any way, so sleep appliances or sleep dentistry, they're probably airway focused. And they probably have a good understanding of the way things should develop. I will say that in my experience, anybody that practices any kind of sleep dentistry, because that's really that's a big focus in airway-centric dentistry, is sleep. So they're somebody who probably has a good knowledge base. It's a good place to start if you're looking for somebody who really understands it. If you're looking for somebody, an ortho, because you want to move things around, you want to look at where they've trained, what their experience is, what are their cases, do they have any finished cases? Do they have cases that they're proud of? Do they have pictures of actual cases they've done that they can show you that they've achieved? Those are good ways to start. And there's absolutely no reason as a patient who's paying for treatment, you can't ask that.
One thing that I want to cover for people who watch this channel, we know that tongue position, resting tongue posture is extremely important. I was wondering if you could just explain for us right now in your explanation of what is proper oral resting tongue posture. If you looked at someone who has an ideal occlusion and they just naturally grew up with, perfect jaws, not perfect, but ideal facial growth, ideal airways, what would their tongue posture look like?
So it would be on the roof of the mouth, basically resting against it's resting against the bone that your teeth are held in, and not against your teeth. So on the palate, it would fit nicely on the palate, and you would be able to feel the tongue all the way to the back, to the soft palate. So it's commonly people think, oh yeah, my tongue's up there. My tongue's on the roof of my mouth, but it's really just that front portion, and it's usually resting on their teeth, and they don't realize it. And that isn't ideal. We want the entire thing up there, because as the entire thing is up there, it will actually help maintain the tissues in the back of your throat, and it'll stay out of your airway. But that's ideal. You're right. It's almost, I call it like a passive lingual palatal suction. It's almost stuck there. Okay, and you're not going to achieve that without building structure and tone and strength in it. So the more toned the tongue is, the more strength the tongue has, the easier will be to just live up there. I mean, there's other reasons. There's structural issues too, like tissue restrictions and tongue ties and things like that don't allow it to happen. But
yeah, and so people kind of know that you need to have your whole tongue up there.
Yeah.
If you have just the tip of your tongue on your upper palate, that's not really going to be enough to cause any significant positive growth or results.
No.
And I've heard other dentists say that as well. So if someone has a tongue tie and they really aren't able to get their tongue, that could be an inhibiting factor, right?
Yes, absolutely. For sure.
Yeah. So I want to quickly touch on what you said with the suction. So we kind of know this in the mewing sort of community as a suction hold.
Yeah.
Which means that you don't really have to try to push your tongue hard on the roof of your mouth. It's just this gentle kind of pressure, right?
It should never be work. It's called oral rest posture for a reason. So tongue on the roof of your mouth, muscles are all relaxed, lips are together, teeth are slightly apart. If they're touching, they're just touching lightly, if at all. And I call it a passive palatal suction because it's passive. It's not work. It shouldn't be forced in any way, shape, or form. If you have to work at it, it means there's something else wrong. It means that all of those systems aren't in place to work in your favor. So and in the mewing world, calling it the suction hold, but it's exactly the same thing. It just shouldn't be work in any way, shape, or form.
I really like how you said that. It's called resting tongue posture. It shouldn't be work.
Yeah.
And I say this all the time as well. You really shouldn't, in my opinion, have to think about, put my tongue up. No. Is my tongue in the right position? Because it's just a headache.
And exactly. And if you spent a year, 2 years, and you're still thinking about having to put your tongue on the roof of your mouth, there's something else that you need to work on to help you get it there. Because the science shows us that after max a year of myofunctional therapy, anywhere from 12 to 15 weeks of therapy, focused therapy, you should be entering what's called our habituation stage, which is where it's just part of who you are. Habituation and generalization. It is just who you are. It's not something you should. Once in a while you go, okay, is my tongue on the roof of my mouth? And you go, oh yeah, of course it is. It's always there. It's just not something you should think about anymore. I don't think about it ever, because it's just always, it's where it's supposed to be.
Agreed. So, yeah, great. And what advice do you have for people to try to achieve that resting posture with, like you said, the gentle hold on the roof of your mouth, the entire tongue on the roof of your mouth? What are some things that people can do? For example, in myofunctional therapy, how does what you do contribute to that?
So we work on strength and tone. And so any kind of myofunctional therapy program, the success of a myofunctional therapy program should be customized. It's not, I don't believe it is a same exercises for everybody kind of program. I think it's why we do what we do. It's very specific to each individual. A lot of the basis is the same, but the difference that we do is you have somebody observing the process and watching your progress. We also look at lip strength, because if your lips aren't going to stay closed, your aptitude to mouth breathe is higher, so your aptitude for your tongue to fall is higher. So all of those things combined are what you're going to ideally achieve. It's not just about getting the tongue on the roof of your mouth. It's about being able to breathe through your nose and keep your lips closed, right? So that's from a myofunctional therapy perspective. We build on that over that year or however many months it might take. and then it becomes habitualized. I forget where your question was going with that, but
No, that's good. And so, because I know in, myofunctional therapy, there are exercises for tongue mobility, which is like stretching the fascia and the tissue under the tongue to help it go up more easily. And then there's exercises where you actually practice that suction hold, right?
Yes.
Where you practice a proper swallow.
Yeah.
So all these things help to contribute to what you're talking about, right?
Yeah, and most of our therapy, each exercise relates to another exercise within therapy. So, for example, any of the weight building, the muscle building exercises, they also work on anterior articulation. So being able to use the tip of your tongue more functionally and then that relates back to chewing and eating. So then you can clean all the crevices of your teeth properly. So then overall you get less cavities. Like it all kind of, and each exercise is relative to the other. So most of the weight bearing exercises have something to do with your lips and your articulation. Most of the lip exercises do more than one thing. They're not just strengthening lips, they're stretching tissue. They're getting tissue to focus in certain ways. And they all relate back to each other and they all complement each other. So just doing one exercise to think and thinking that sticking your tongue up on the roof of your mouth and doing it for hours and hours and on end is going to change everything isn't an ideal way to achieve proper oral rest posture.
Do you have any advice? What advice would you give to people in general? Just lifestyle things for how to be healthy, for how to, maximize, improve their resting tongue posture. Is there anything that you would say for people to do other than obviously just to do myofunctional therapy and find someone really good to work with? Just for an everyday person, what are some things that you would?
Breathe through your nose. Figure out how you can breathe through your nose all the time, even while exercising. Things will become more efficient. That's the big clincher for me. Breathe through your nose, obviously the normal, eat healthy, get exercise, things like that. But from a general perspective, if you want to achieve a better oral rest posture, and you can't say go down the route of orthodontics, you can't go down the route of myofunctional therapy because a lot of people can't. It's something that might be out of somebody's reach. You can practice getting your tongue up there, but nasal breathing one of the main driving factors of all of this is airway. So figure out why you're a mouth breather figure out why it's not up there in the first place. And if you can fix that problem, then you're halfway there. So airway, I always come back to airway and breathing through your nose, and posture comes into play as well, because if you're going to be text-neck and over your technology all the time, it's going to be that much more difficult for you to get a breath of air. And what's going to happen is your body's going to compensate. We can live without food for however many days, we can live without water for however many days, but I think the maximum we can live without air is 10 minutes and your brain starts to go. So our bodies will always compensate. So if you're sitting over your technology or you're sitting in a certain fashion, your body is going to adjust itself to get air. And so being mindful of your posture and being mindful of your head over your shoulders, over your hips consistently. So it comes back to that same old thing that your grandmother or your great-grandmother used to say is, sit up straight, keep your mouth closed, and chew your food. This is not new stuff.
Yeah. Very good. And one last thing for parents, because you went through all of this, and if you were able to breathe through your nose when you were a kid, if you discovered this early enough, then you wouldn't have to go through all the things that you're even going through now to solve this. Yeah. And it's the same for me. So how do parents catch this early? How do they instill proper habits in their kids when they're young? At what age is it okay for an infant to be breathing through their mouth? Never.
Kids, okay, so think about it. We are all born nasal breathers. it becomes an issue as we develop. We are all born nasal breathers. We go on the breast, we drink on the breast, we breathe through our noses. If there's a functional issue with the tongue, so if a baby's tongue tied, that really is one of the only reasons a proper latch won't happen during breastfeeding. If that doesn't happen, kid might get too much milk, kid might get sick, kid might get colicky, kid might get air, and then it starts to develop a different process. And then maybe mom gives up. Parents give up and they give a bottle, and that introduces a different swallow pattern and can introduce an inflammation happens in the back of the throat. So then the baby starts becoming a mouth breather.
So
they're allergic to something in the house, which was my kid's case.
Right. So I have like someone in my family just had a baby, and the baby, I noticed, has its mouth open and its tongue is just hanging out.
So depending on the age, it's not normal that will go away within, I don't know the age, but the tongue protrusion with a newborn is normal.
Okay.
But it goes away, it should be gone by, I think, 6 months or something like that, or less. The first 12, 16 weeks, that's kind of normal.
So past 6 months, the baby should be breathing through their nose.
Absolutely.
And so say I have a newborn baby and I'm going to be raising this kid for the next 10 years.
Yeah.
What would you tell me to do in terms of, feeding them, tougher foods or making sure? What are some things that you would advise?
I would encourage chewing on harder foods when possible, within reason. The Health Canada says to introduce solids at 6 months, which you can do. You can introduce solids at 6 months, but solids don't have to be necessarily mush. They can be soft carrots. You can introduce other chewing tools even earlier. There's no reason an infant at 3 months can't chew on something that they're not going to necessarily choke on. You've seen photographs of kids being given chicken bones at 3-4 months just to chew on, just to simply get those muscles to start functioning, to help grow the bone, right? If your kid can't breathe through their nose, figure out why. There's a lot of snot-nosed little babies around, and that's the issue. That's the bigger issue, is that crusty-nosed kid is not breathing through their nose. So figure out why they're a crusty-nosed kid.
And they're going to have a lot of problems later in life.
Yeah. Because they're going to learn how to breathe through their mouth.
So it seems like the bottom line is, as your kid is aging, make sure they're not mouth breathing.
Yeah.
If you see them walking around with their mouth hanging open, that's a real problem.
Yeah. And sleeping with their mouth open. It's one thing that parents don't realize is because we don't watch our kids sleep. We might for a little bit of time. I mean, I know I did with my kid for a little bit. But watch how they sleep. Watch their sleeping positions. They're sleeping. We think things are normal. We think that, my kid's a kicker. It's hard for my kid to wake up. Kids are supposed to wake up pretty easily after, say, 8 to 10 hours of sleep, depending on their age. My daughter always snored. My daughter always slept with her mouth open. And I never really thought about it, because I was told she might grow into her tonsils. So those are the things that you got to watch out for. Mouth breathing is the biggest key, and it's one of the easier things to solve when they're that young. Because even if they have a tongue restriction and their tongue's not even living on the roof of their mouth, if you can get their lips closed and have them breathe through their noses, that will change their lip posture. It'll change how their lips develop. It'll change how this whole sort of structure can develop. It's interesting how there's been this change over the last 35 years, 40 years, 50 years, however long. I think about movies, and I'm not that much older than you. I know I'm older than you, but I think about movies from when I was a kid. Being a mouth breather used to be a derogatory term, but now it's kind of normal. It's not a thing. It's just you're a mouth breather or you're not. But being a mouth breather used to mean you were a sub-level human. And not that we should go back to that, but we've changed the way we look at things that way. And it's, again, we think it's normal. We think it's normal to have allergies. All of our kids have allergies, and everybody has to eat different foods and have different things to eat, and this free and that free. And it's become normalized. It's normalized in the grocery store. It's normalized everywhere. But it's not normal. Normal.
Yeah. I feel like we could do a whole other video on that. We could talk about
On
so many
food.
things.
Oh, yeah, for sure.
But yeah, no, this has been great. So thank you so much for doing this. And hopefully everyone watching learned a lot. And yeah, I really appreciate it.
Thanks. Thanks for coming in. And yeah, I think we can absolutely change things as we move forward. It just takes time. And I think it takes dentistry as a whole needs to change. Personally, I think it does. To become, we call it preventative dentistry, but I often question how preventative we really are.
So really quickly, just on that note, do you want to tell people what you're doing? Like, because you're working with myofunctional therapists. So if there's a health professional who wants to get in touch with you, do you want to share where they can find you, what work you're doing?
So I work as a myofunctional therapist in Toronto. I'm somebody who does all my assessments in person. So if you're not in Toronto, you can certainly find myofunctionaltherapist.com. May be able to help you find somebody within your area as well. But if you're certainly in Toronto or the GTA, if somebody is interested and they want to contact me, I'm connected to a number of healthcare providers across not only the province, but across Canada that do myofunctional therapy, whether it be a speech-language pathologist or a registered dental hygienist.
And then you're also doing like teaching myofunctional therapy classes, right?
Yeah, so I've started teaching a program. It's a 30-hour program with a 6-hour prerequisite. I've started teaching because there seemed to be a need for it in Canada. There's organizations in the States that teach it. There's a couple of groups in Canada that teach it. I've started teaching it exclusively to registered dental hygienists. My program is catered to registered dental hygienists, specifically to work myofunctional therapy into our process of care and how we function and what we're, as a regulated health professional, what we're responsible for. So that's how I've developed my program. And so I've been teaching, and I don't teach large groups of people. I keep it very small, so it can be very one-on-one classes. And I've been doing that. I've had my first cohort in December of 2021, graduated, and they're all practicing now, which is great. I have a belief that I would love it if registered dental hygienists really owned myofunctional therapy and really brought it into their practice. We don't do it enough. The first time I taught my intro course, it was so well received because people don't know about it. We're not taught this in school as dental hygienists. We're not taught about proper oral rest posture in school. We're taught head and neck anatomy. We know what a tongue tie looks like, but what do you do with it? Right? So I've been teaching it I've been introducing hygienists to it for about a year now, mainly across Canada.
And how can people find out about how to enroll in the classes?
So the classes, I work with a company called RDHU, which is out of Stony Creek in Ontario. They're quite a large body of that serve sort of registered dental hygienists learning varying continuing education programs. You don't necessarily have to be a registered dental hygienist to take one of their courses though, but it's called RDHU.
Okay. Awesome, great, thanks, Joe.
Awesome, nice to have you here.